Doctor, just tell us briefly what gynecology is.
So, gynecology is about the medicine of women and their reproductive system.
Okay.
So, as I was saying earlier on, we see women and issues that are peculiar to women.
Okay.
So
the breast is inclusive.
The breast is inclusive.
Okay.
But then, in the Ghanaian jurisdiction, much of the breast medicine is done by general surgeons.
Oh, okay.
But then the gynecologists can equally attend to the patient who has breast complaints.
Okay.
But if it becomes a surgical procedure, if it requires a surgical procedure, then we get the general surgeons involved.
Okay.
But elsewhere, gynecology includes the breast diseases. So then the gynecologist does everything, including the breast surgeons. Breast surgery, sorry.
Okay. Actually, the only one. There are so many females who don't really see the need to go and see the doctor unless probably it's something very serious, mostly with fertility issues. And so what's going on? You have to go and see a doctor. Then you see the need to go and see the doctor. So at what point should I actually see a gynecologist, doctor?
Well, practice of medicine in its ideal form, every person should have a general practitioner that you will be seeing.
Okay.
As in a doctor that you should be seeing regularly.
Oh, okay.
So as and when you make a report to your general practitioner that I have this complaint or that complaint, and then the person thinks that you need to see a specialist, then you are then referred to see a specialist. But as I said, that is in its ideal form. So it happens in the developed countries.
Okay.
In our setting, people only go to see the doctor when they are not well. So when you are unwell and you see any doctor at the peripheral levels, and then they assess you and think that what you have will require a specialist, then you are referred to see the specialist. Usually you will find the specialists in the bigger hospitals.
Okay.
A few endowed district hospitals, yes.
As for community.
Regional hospitals, and then the teaching hospitals. So if you go to the smaller hospitals and the clinics, and they do not have a specialist, they would refer you, and then you then end up with the gynecologist to be seen. So that's our practice here, because in the ideal form, you have a general practitioner that you will be seeing regularly. So if it is every year you have an appointment, you go, and if you have issues, the person will assess, and if you require a gynecologist, they will refer you to.
So let me
but in our setting, we do not have that.
Okay.
So once we do not have that, if you have an issue, then you are encouraged to see a doctor. And when the doctor at the primary level thinks your problem requires a specialist, then you are referred. Usually specialist services is not a walk-in service, so you cannot sit at home and just say that I feel like seeing a specialist today, and then I get up and I go. Our setting right now, in the public sector, the gynecologists are few. So it is not a walk-in service. You need to see a primary doctor first, and the person will now review your situation and think that you need to see a specialist and refer you to see a specialist.
Okay, so I want to know what is considered normal. We have ladies who have who complain of having abnormal vaginal discharge.
So you should know yourself in the first place. So if you know yourself, when something goes amiss, then you know that this is not regular with me.
Okay.
What someone may see as normal may be abnormal in the eyes of somebody else.
Okay.
So ideally, you shouldn't have any copious discharge, in a lot of discharge in your underwear at the end of the day. You shouldn't have abnormal odour emanating from your private parts. You shouldn't have itches and then sometimes even the coloration of the discharge alone tells you that this is abnormal. So normal discharge is not something you should see in your panty all the time. Normal discharge has to do with the times of the month. So in and around your ovulation period, then your secretions increase. Then you will have a clear vaginal discharge around that time. Barring that, anytime you have any discharge, then you should seek an opinion for them to tell you whether it is okay or it isn't. The only time you should freely see discharge is when you are in and around your mid-cycle. Then you have a clear, does not smell, non-offensive vaginal discharge. If not,
so once it's offensive, then
once it's offensive, one is too much. Once the color is not, it becomes yellow, it becomes green, it becomes blasting, whatever. It is not normal.
So the normal one is colorless.
It's clear, yes.
It's clear.
It's clear.
Oh, okay.
And it's not copious. It's just small. You shouldn't even see it that much.
Okay.
But once you start seeing your panty stained with discharge every now and then you should have an examination done.
Okay. Oh, thank you. So Rama, do you have friends actually confided in you with some of this gynecological issues?
Yeah, I think I have few, especially those with the menstrual cramp as well. They complain so much, like when they're in their menstrues, it's malaria. They are just on bed taking meds. I had one friend in SHS, like when she's in her menses, she's always taking drugs.
Drugs?
Yeah.
To subside the pain.
The pain.
Doctor, is that advisable?
Well, pain relief usually, if you are in pain and you go to the drugstore, I'm sure they will sell 1 or 2 medications for you to relieve the pain.
So is it advisable?
But then, mostly for young girls, it is like common to see young girls with very bad, painful menstruation. What we call dysmenorrhea. But if it is that severe, say that you can't do anything when your menses come, you are in bed, you're sick for that period, you can't go to class and all that, it is good to be evaluated by a doctor and probably by a specialist. If there is nothing found, there are some good medications they can put you on to make your life regular, so that you do not have to you shouldn't have regular sick leaves like every month. But then there are times that very bad menstrual pain is also associated with some complicated matters in the reproductive tract. So when you are seen and these are noticed, then correction can be done to relieve you.
What
pain during sex, we call that dyspareunia. It is not normal pain. Sex shouldn't be painful. Now, when a woman is experiencing painful sexual intercourse, it can either be pain in and around the outside of the vagina, or pain that is deep inside. So it can be superficial or it can be deep. So depending on where the pain is, if it's superficial, sometimes it's lubrication problems. She's not well lubricated, and then, or maybe she has some vaginal infection, she has some candida or something, the place is already inflamed, and then the act of sex now abrades the area even more, and then it becomes painful.
What about the man's size? The size of the penis, can't it
is also related. But then when it is deep, there are certain disease conditions that can cause that. So if you have painful sex, it is good that you come and then we assess you and see whether there are any problems that can be corrected to make your life much easier.
She actually confided in her boyfriend. The boyfriend was like, that is normal, like sex should be a mixture of pain and pleasure. So she was relaxed about it and didn't do anything, hasn't done anything about it till date.
So that means the pain is gone?
It's still there.
Well, if it's there, she can come and we'll have a look at it.
Wow.
And see whether there is anything that is worth treating.
She will definitely come. I'm very curious about that. Actually, you mentioned earlier on that we have few gynecologists in Ghana, for instance, and you happen to be one of them. Humbled one. So tell us, how did it all start? Was it something from childhood, or it just came out of the blue?
Wow. It's a long journey.
Okay.
Yes. Well, as a child, I knew that I wanted to work in the hospital some way, somehow, because I was the hospital baby kind of thing, because I was always sick. So I think every other month or every month I'll be down with malaria. So I really was frequenting the hospital.
The way Rama is looking at you, I know she wants to be a gynecologist.
And seeing the doctors, and I happened to be attending 37 Military Hospital then. So smart uniforms, neatly dressed, white uniform. It was just so nice looking at them. Very professional in their job. They take care of you very well. Yeah. So I admired them from then, and I think it's carved my interest in doing science. Okay. So I did science in SS, Tamasco. Okay. And then from there, obviously, since I wanted to do medicine, I continued to Legon and did medicine. It was okay, it was difficult, but then at the end of the day we
as
graduated.
usual, the females in the class were less.
Yes, in Tamasco, for instance, in my class we had 5 girls out of 47 or so. So we had 42 boys
42
and then 5 girls. But it was, we always had to stand up to them because they always want to cheat you see.
It's usual of them.
But then it all went well. Back in medical school, it wasn't, the disparity wasn't that much, though the
Which
males,
medical school specifically?
University of Ghana.
Okay.
Though the males were more than us, but then we had significant number of women in the class. So, and we always matched them boots for boots.
Boots for I like that.
So, and yes, but at the end of the course, I mean, the girls were tops as usual.
Wow.
Interesting.
Yeah, the girls were tops.
Wow.
So I graduated from University of Ghana Medical School. Well, I was the best student in my class.
Wow!
And graduated with 10 awards from University of Ghana. Then I went to do my house job in Cape Coast, Koforidua, and then Accra Children's Hospital. Initially, I wanted to be a pediatrician because I liked the babies. But then my experience in Princess Marie Louis Hospital made me change my mind.
Princess Marie Louis Hospital, where is that?
It's in Accra, right in Accra Central, the UTC area.
Okay.
You had a lot of these Kaya girls come there with their very sick babies. Every day you go to work, you have to buy medication for a child that is convulsing and the mother has no money. It was very heartbreaking seeing these children die because health insurance is not providing what they need, and the parents also do not have the money. So I felt that if I was going to continue as a pediatrician, I'll become depressed.
Just because you're helpless, you couldn't help.
Yes. So I changed my mind. So I went for obstetric and gynecology, which was my second favorite.
Oh, okay.
And it also went well. I did that in Kolebu. I completed my membership in 2015. So I've done Ghana College of Physicians and Surgeons, and then I've also done West African College of Surgeons.
I'm speechless. See, I'm looking at you.
Yeah, so for 2017, the West African College also, I had an award as the best female for membership. But those are very little achievement. Those are just
Really
for the papers. The best achievement is when you see your patient gets well.
Wow.
So that is when you are glad. All these things are
Like
just for the books and maybe for the news.
So would you say that your achievements were actually driven by your passion for the job, or?
Well, my first passion was to see my mom's tears dry. Yes, because she went through a lot to get us to do what we wanted to do. So I never wanted to fail. I never wanted her hard work and all that to go in vain. So I needed to learn. And then the awards and all those things that came as a bonus. They were not the primary targets. The primary target was to pass the exam. So, but then it's worth it, because when you see a patient get well, when you see a childless woman end up with her child, when you see a woman who is in so much pain and suffering ends up walking home, you get
inner joy.
Yes, you get an up. It doesn't translate into money, but then you feel good about it.
The way you are looking at it, I will ask you, have you ever had a little bit of thought about becoming a gynecologist?
No, I've never thought of working in a hospital.
Why? Like
I'm afraid of blood.
So many females.
No, I'm afraid of blood.
Seriously,
I can't.
When I hear females say that, I'm like, what? You're afraid of blood? But you see, like every man, why it's different.
It's different. Like even when I see a cat, I can't stitch. I can't clean a cat.
Really?
Yeah. So doctor, to every lady out there watching and probably praying and hoping to be a gynecologist like you, what do you have to tell them?
It's doable. It's difficult.
It's workable.
Yes, it's difficult because it's difficult, but it's possible.
It's possible.
I went to start my membership program. I had my first baby then. So I started the program with a 5-month-old baby.
Oh, wow.
And then in the middle of the program, I had my second baby. So I had a baby. And then I ended with my third baby.
Even still during the program?
So it is not that's easy. And it is possible to combine that with wifely duties, motherly duties, and so on and so forth. It is doable. It's difficult.
Doable.
What you need is a supportive spouse and also a good and understanding.
My dear man, I hope you are listening. No, a supportive husband.
Exactly.
Okay. I like that word you use.
Yeah, supportive.
Very supportive, yes.
Good and understanding.
Yes, because my husband did support me a lot.
Wow.
Because at a point he took care of the first whilst I was in school with the second.
So for how many years? Is it that you finished?
3 years. From medical school, you do another 3 years.
3 years to specialize.
For specialization. And then if you want to go and do the fellowship, that's another 3 years.
Okay, Rama, what do you have to tell every young girl out there listening to this program?
Well, I think it's good we all once in a while try and visit a gynecologist just to find out what is wrong with us. For future, you don't know what is happening to you, so you need to actually find out what's wrong with you, then if there's any treatment or not. But Dr. Hawa, I have a question. Do you do any private practicing anywhere, or is just the general?
It's just general.
Practice.
Oh, okay.
So in the teaching hospital, that's where I am.
Oh, okay. Okay, so if we have an issue and we know that, like you said, it's not easy to get in touch with a gynecologist on a normal day. We have to pass through some procedure, finally be referred. So if I'm a lady with an issue, by virtue of the fact that I'm privileged to know you, can I come?
Yes, so usually, if it is pregnancy related, usually the protocol is very short. So once you come to the antenatal clinic, you see the midwife and then you get to see the doctor.
What if it is more of a reproductive?
Yes, but then if it is a medical issue of a woman, then that is where you will require a referral to come. So at the level of the outpatients, even in TTH, they can give you the referral. You just need to go and see them and say, you want to see a gynecologist for this, that.
So I can't see you one-on-one?
Well, if you come and see me on one-on-one without a referral, that is the procedure aspect. If I do that, then my facility may not be paid. If I have to use an NHIS to see you. NHIS will only see patients that have been referred. So I will need the documentation that you have been referred to us. Well, that's procedure-wise. But if it is on one-on-one basis, we can always make room.
Well, I'm booked already. Okay.
I'll be the next person.
We can always make room. But then for the public out there, for them to understand that there is a procedure to see the gynecologist. You just don't get up and pick your bag and say, today I think I need to see the gynecologist. But you can end up seeing the gynecologist today, but you have to go through the outpatient first, and then the physician at the outpatient will see you, and if they can't solve your problem at that level, they will refer you.
Wow. I think I've learned a lot today, and I know you have also learned a lot. Okay, thank you very much for listening to this program.